Migraine happens typically first thing in the morning for 71% of the sufferers. They have headache in the morning. Now take a look at this study from The Lancet. 62 consecutive subjects that have chronic headache, ruled out all the dental problems, had it most of their lives. I've seen plenty of doctors already. Could be bilateral, sometimes unilateral. And they'll usually wake with a degree of headache. I recognize that patient. They made an anterior bite plane. After 6 weeks, 2/3 of them had resolution. What's really crazy about this, and at 3.5 years, they still were okay. Did no. It was in 1960. It was a long time ago. Why isn't anything done with it? Because that's not a manufactured device. You have to publish a bunch of studies and convince dentists to do it. And in 1960, that wasn't on the radar. At our neurology clinic, we presented this in Berlin, I think, but 20 consecutive chronic daily headache patients. Chronic daily headache is a medical diagnosis. They've got migraine at least 12 days a month. They've got a headache every day. These are the worst of the worst patients. You can't do anything with them. And so those are the patients that we worked with. And it was the same consideration, the same components of this prior study. We make an NTI device and we use what's called the headache impact test, or the HIT6, or 6 questions. How badly does the headache impact your life? And so 9 patients had no impact, 5 patients some impact. That's a fantastic result for this group of patients to have that sort of resolution. What was most important, though, in the neurology clinic wasn't these successes. I told Dr. Blumenfeld, I think it's going to work on everybody because my family says I think everybody clenches and NTIs just help everyone. So that's what's going to happen. Sure enough, it didn't. They all seemed like the same, but when I could present a patient that fits this criteria and an NTI doesn't help them at all, that's a fantastic rule out for the neurologist. Those guys just light up. So in in the neurology clinic I associate with, there's like 7 guys in there. There's 4 of their wives were NTIs, their daughter, all the whole thing. If they go, that didn't help that patient, and I've had one patient had an elevated cerebral spinal fluid pressure. Because as they start to thought about what could it be, they could find these more weird things. And neurologists love to find weird things. That's what they're supposed to do. So I could rule out for them usual and customary.